Adoption of the November agenda.
Oh, we do have guests, Ruth. Can you introduce yourself, please, Rachel?
I'd be happy to. My name's Rachel Hansen. I work at SDIU Local 503. My plan is to be here for about an hour, and then I have to jump to another meeting, but I'm happy to join you all when I can.
Thank you. Okay, ask for adoption of the agenda. Need a motion?
Don't move, Commissioner Mayor.
Commissioner Adams, second it.
All in favor?
Aye.
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 Any opposed? Okay. October minutes. Need a motion?
So
Aye.
moved, Commissioner Mayor.
Aye, Commissioner Adams, second it.
Okay. Any discussion? All approve?
Aye.
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 Any nays? Okay, thank you. Announcements. Jenny, do
Ruth,
you
we
want to
just
make
got
an
another
announcement?
guest.
Okay. Who is it?
Adam, can you introduce yourself to the group, please?
Yeah, I just started a new role as a partnership coordinator with Carewell Training.
Oh, okay. Thank you.
Thank you.
Good morning, everybody. I do have an announcement. I have been named as the permanent executive director of the Oregon Home Care Commission, and I will be removing interim from my signature line. I want to thank the commissioners for all your support and advocacy for me to be in this position. It's so heartfelt, and I'm excited to continue leading you on a permanent basis.
Congratulations, Jenny.
Thank you.
Yeah.
It's wonderful news.
I told Jenny we need to have a party now with great peanut butter cookies.
Absolutely.
Oh,
Are you thinking of the little Lois's cookies?
Yeah, those are on my mind.
I was going to say, he's always thinking of those little Lois cookies.
I'm just grateful that we finally saw this happen. And I know that the commission, I don't want to speak for everyone, but I believe I can. We're very much in favor of seeing this happen. So we're excited for you.
Thank you so much.
This is Commissioner Adams need to make an announcement. HERC from OHA is trying to find people in the advisory committee to be on the HERC through OHA. And I had talked to, I think his name's Jason, on the HERC. And they're going to be looking for people with all types of disabilities as advisory committee connected to HERC. So look out for the announcements for them looking for people, wanting people to be a disabled person to be on the advisory committee for the HERC, a separate one.
George, what is HERC?
I'm trying to understand it myself. It has
Okay.
a lot to do with the change that's going to be taking place the 1st of January. The coverage that the CCOs may not be able to cover. It's through OHA. I'm trying to understand it myself.
It's part of what the feds are doing and bringing down some new Medicaid money and different things and different ways that Medicaid can be used. And one of them is that the meals where you can use your EBT card if you're elderly and go into a restaurant and use your EBT card.
Oh, great. And
So there's all kinds of things coming down.
There's a note from the ASL interpreter. Is it HERK or is it HURK?
HERC.
Oh, HERC. Okay.
Jenny, I sent you and Heidi, and I believe Ruth might have been the other one. I sent the bill 1595 or 1585 to, and I also sent the other emails on what the food stamp thing is about. Going into a restaurant. It was only going to be serving seniors, people with disabilities, and the homeless. And then ODS or APD 1 and 2 will have to be the one that they will be responding to with that new advisory committee with that one.
Thank you, George.
Mhm.
Any other announcement?
Yeah, George, can you send a copy of that email you received?
Yeah, I gave it to Heidi and Jenny. They should give it, they should be able to give it to everybody.
Thank you.
Okay, public testimony?
We do have public testimony today. All right, begin testimony. Public testimony for November 2024 OHCC meeting. Full disclosure, I am an SEIU Local 503 Board Director, Home Care Council Director, and Home Care Bargaining Team member. I am not speaking for the union in any capacity. Questions in this testimony are not rhetorical and require an answer from the OHCC. When a consumer goes into the hospital for a period of time that is not long enough for a home care worker to claim unemployment, it can cause a financial strain for the worker. The state should provide some form of financial assistance when this happens. What is the state willing to do? OHCC needs to respond to the above during the meeting. Along the same lines, the worker does not get paid when a consumer has an appointment with a medical provider. Once again, this can cause financial strain for the worker. What is the state willing to do? Please keep in mind there is a shortage of home care workers, and this situation could cause some workers to quit being home care workers. OHCC needs to respond to the above during the meeting. Other causes of care providers losing income include the consumer going on vacation, leaving for a funeral, having another emergency, etc. Is the OHCC willing to address this issue? Please keep in mind that OHCC workers do not have their income interrupted like this. OHCC needs to respond to the above during the meeting. Time is of the essence. Now that the OHCC and DHS have been aware of their shortcomings and failure in a public meeting, they cannot take the position they did not know. Testimony respectfully submitted by Avery T. Horton Jr., home care worker, citizen, voter, taxpayer, State of Oregon, as always, acting in individual capacity. End of testimony. So I'll start from the beginning. Providers do have the option of applying for unemployment benefits. It is up to the employment department whether those benefits are approved or not, but I would always encourage providers to reach out to the employment department and submit a claim. Any kind of financial assistance would have to be done through collective bargaining. With regards to getting paid when a consumer has an appointment with a medical provider, I did reach out to the APD policy unit for clarification, and I did share that in email with Mr. Horton, but I will also read it here as well so everybody's aware. The response from the APD policy unit is a home care worker can be paid to attend medical appointments if the consumer has assessed ADL care needs that the medical provider is unable to or unwilling to assist the consumer with during the appointment. The consumer has no natural supports able to or willing to attend the appointment, and the consumer has assessed ADL needs that would occur at the appointment. Example, if a consumer with assessed needs in transfers and dressing has an upcoming medical appointment, during the appointment, the doctor's office will not provide assistance with ADL support. At the appointment, the consumer needs help getting up and down in the waiting room, in the examination room, and they need to change in and out of a gown. These are assessed needs, and the consumer would be unable to accomplish the task without another person's help. A home care worker can be authorized to attend the appointment to provide that assistance. Similarly, with cognition, if there are assessed as if they are assessed as needing support in this area, and without the home care worker's help, the consumer would be unable to accurately report care needs and or retain crucial information provided during the appointment, we could authorize the home care worker to attend and provide assistance. We cannot authorize the home care worker to attend just because the consumer wants them to or just in case. For non-emergency medical transportation, where a consumer has an assessed need that would go unmet during the ride, a provider can be authorized to accompany the consumer on the ride. The case manager would need to know how the provider is serving the needs of the consumer during the drive to and from the appointment, how their assistance promotes the individual's health and safety. The consumer would need to adjust the home care worker's hours so that the home care worker can provide assessed services that are not met during transportation or at a medical appointment.
Jenny,
Can I, let me just finish my response if you don't mind real fast. For losing income when a consumer is going on vacation, leaving for a funeral, or having another emergency, I would encourage home care workers to tap into their paid time off benefit if they have it through CareWell SEIU 503 benefits. And that's my response. So sorry, George.
Jenny, does it, as far as transportation with a provider, going with the consumer to a medical appointment and stuff, down here, down at TransLink, which is underneath the CCO, is called I think it's called a PDDD. It's where a provider is able to go with the consumer down here to a medical appointment instead of having their own car. And also, if a provider needs to go with the consumer to go out shopping, they're also allowed to do that down here too as well. I'm not quite sure about the rest of the state, but they do that down here. And the state, because of the contract and stuff that goes on between state and the CCO.
Thank you, George.
Paul?
Yeah, just maybe a clarification too that might help a little bit. So there's really two types of transportation I think that may be helpful to understand. One is called medical transportation or non-emergent medical transportation. And that is a medical benefit through Medicaid. It is not a service benefit through Medicaid. Therefore, it is not something that APD is involved in administering or managing. The medical benefit through OHA or the CCO, as George just kind of mentioned. The other type of transportation is called non-medical transportation, and that is where an eligible consumer, an in-home consumer, can receive transportation from a home care worker or a contracted transportation provider to go shopping, to the beauty shop, those type of things that meets an ADL or IADL need in the individual service plan. And so those are the two types. So non-medical is something that APD consumers can have access to. Medical is not something that APD authorizes or provides. That is done through OHA. Now, an individual needing assistance, as Jenny just read that information, a home care worker can provide authorized assistance for ADL needs during the transportation or at the destination if needed, but that assistance is part of the consumer's, to meet a consumer's need. And the consumer would need to budget their hours with their worker so that there would be time available for the worker to provide this type of assistance during a medical appointment. The department would probably not grant exception hours for a assistance with a medical assistance during a medical visit. It would have to be from the hours currently authorized, and the consumer would need to adjust their hours so they're available if needed for the home care worker to provide assistance with ADL needs during the trip and at the destination. So that's just a little bit of the nuances here in regarding transportation.
Thank you.
Thank you so much for adding that, Paul.
Okay. Then let's move on to the Governor's Commission on Senior Services.
Okay, well, as you know from my last month's report, I attended an Oregon Gerontological Association virtual webinar. And one of the sponsors was the GCSS, so we were asked to send 2 commissioners, and I was one of those 2. Learned a lot about that, and as a result, I have now signed up for a second webinar, which is called The Changing Landscape of Dementia and Housing Insecurity. And that's going to be on the 21st of November. And after that, I should have something to report back to the group. And the second thing is, maybe I should have put this under announcements. I was just notified that as of the 1st of October, I've been appointed to the advisory committee to the director of the Oregon Department of Veterans Affairs. So I'm very happy about that, and I'll still maintain, the GCSS and the Home Care Commission. So, but just wanted you to know that now I'm officially representing vets, I guess.
Okay.
Congratulations.
Thank you.
Congratulations.
Thank you, George.
The Oregon Disabilities Commission.
I have nothing to report. Our next meeting is next week. So I will have something this month.
Okay. Thank you. The Oregon Association of Area Agency on Aging and Disabilities.
Sorry, I didn't think I had much about a report out for today. I will say that O4AD is creating updates to election news. If you aren't a person who receives information from O4AD, please make sure to go on to the website. You can sign up for email updates and information. And so yesterday there were 3 or 4 different updates. It's amazing that throughout the day things were changing. So a lot of volatility and of the election still. So make sure that you go on to the O4AD website and sign up for updates if you don't have those. Other than that, I can't think of anything. The last couple times I've talked a lot, so this time I think that's all for me today.
Oh, I'm sorry. Marcia.
Heidi, you need to move the agenda up, please. Okay. Let's see, where are we? Community Advisory Councils. Do we have a report there?
Oh, the CACs?
Yes.
Yes. I'll put both the CAC and the CCOs together here. That way it's one form instead of 2 separates. Come January 1st, 2027, there's supposed to be a change coming. The HERC, I was in a meeting with the HERC, OHA, and it doesn't look good because some of the coverage that the CCOs may not cover, like the spinal infusion is one of them that is talked about that it won't be covering when someone becomes a para or quad in a hospital. There's been a lot of discussions as to what will be covered and what won't be covered. I think it has a lot to do with the Medicaid waiver. I think it ends next year in January for some of these services. Or is it, maybe it's 2027 that it's ending, but anyhow, whatever the CCOs don't cover, HERC has to decide what is sufficient and what is not sufficient in coverage. When it comes to example, like the allergies, what type of allergies, what type, how allergies are being made. Is that going to be covered by HERC? HERC is the one's going to be making out the decisions. And it's not all going to be all the CCOs. There's an array of different codes for the CCOs that's coming out that they have to figure out before the year 2027. So Medicaid is going to be so messed up when this comes into play. I'm trying to understand it myself, and a little concerned myself because of Medicaid. I do know that Medicaid isn't the only one that's going to be messed up. Medicare next year will also be messed up. I'm bracing for both, and I hope everybody else is bracing for it too. I'm hoping that the governor's budget comes out the way it's supposed to be, because so the CCOs can be receiving money like they're supposed to be receiving to do what they need to do. That's my concern about that. I can give you more
Yes.
about what's going on the next meeting coming up in December.
Okay, thank you.
Mhm.
Okay,
Uh,
Heidi, have we,
Ruth, could I share from
Yes.
PD?
yes,
So not a whole lot of information to share, except some news that I think would be exciting to share as well. And that would be that, as you are aware, Matt Raposa, the former Medicaid Services and Supports Manager, is now the LTSS, Long-Term Services and Supports Administrator, the position formerly filled by Jane Ellen Whiteance before she became a Deputy Director over Policy. And so that left a space in our unit for a manager. That space has been filled and will be filled on Tuesday by JD Tilford from our unit. And I wanted y'all to know that JD Tilford is the new manager for the Medicaid Services and Supports unit. We're all excited. JD is a very capable individual. He thinks well and knows policy well, and should be a wonderful person in that role. And I wanted you all to know about that.
how soon before we can tap into her to come and share with us?
Well, he officially begins on Tuesday of next week. So anytime, I would say, Ruth, and I'm sure JD would be pleased to come and share whatever he's asked to share. So it would just be a matter of an invite at this point.
Okay. Thank you. Okay, has anybody heard from Nate?
No,
Okay,
Ms. Chair,
we're, yes,
Ms. Commissioner Adams, did you want to share? I should have said something when it came to announcements. Did you want to share with the group and what we're doing with the one system? Or did you want to do that another time in December?
we've got a few minutes here. You can go ahead, since you're chair of that committee, go ahead and share.
Okay. On the one system we're Ruth is part of, we are doing a lot in that committee. We're going to be, actually, the state people are going to be bringing in AI, and that's supposed to be different for people speaking different languages. It's supposed to help with English, Russian, Chinese, Japanese language, Spanish, French, when they're signing up for services. We're doing a whole array of things on the one system and making it better. With the meeting that Ruth and I was on yesterday, came to find out that the one person on the one system is responsible for, or will be responsible for, the new SNAP program coming up that is going into where you do your food stamps into restaurants. And we didn't know that until yesterday's meeting. So a lot more new progress is coming on the UWA system, trying to make it better, trying to make it easier. And we're doing really good.
And that's,
Question. Sorry.
go ahead, Marcia.
You said that, you know, a disabled person could use it. How will restaurant people be able to identify a disabled person? Some don't have braces or missing limbs. How will they know? Will there be an indicator on the new SNAP card that you are eligible for this?
I don't know. Ruth, do you know?
We have not gotten that information yet. That's one of the questions that's being asked too. Okay, we need
Right.
to step aside on this and let Nate go ahead, and then we can pick this back up later. So go ahead, Nate. You want to introduce yourself and what you do?
Sure, I can introduce myself okay, and what I do is always questionable, so we'll see. So, hi everyone, I'm Nate Singer. I'm the Oregon Eligibility Partnership Director. So for the Oregon Department of Human Services, and on behalf of the Oregon Health Authority and Department of Early Learning and Care, the eligibility for medical, so for Medicaid, Oregon Health Plan, for Medicare savings programs, for all the versions of Medicaid OHP, so OSIP-M, all those financial eligibilities, the staff that do it across the state and the systems we use is what I oversee, as well as our food benefits, such as Supplemental Nutritious Assistance Program, or cash benefits like the Temporary Assistance for Needy Families, and childcare benefits for the employment-related daycare. So I get to come before you usually to talk a little bit around the one system, that's our Oregon eligibility system, but also around eligibility and just benefits and things happening. So really just appreciate the time this morning with everyone. I'm going to provide a quick update on a few things, and then I always like to turn it over to George, Ruth, the whole commission, just to see what questions or things you can tell me that are happening so I can hear it, but also any things that you want to help inform. So with that, I just want to provide a couple quick updates around some things and where they are as we move through it. The public health emergency unwinding feels as long as the public health emergency some days. So we are still unwinding the public health emergency. As a reminder, COVID is still there. And, you know, it's something that we continue to tackle and move through. But the public health emergency officially ended, and as part of that, for Medicaid, that meant that we, for across the nation, every state, every province had to go back through and review individuals for Medicaid. And so in Oregon, we have some complexities to ours, because not only are we reviewing you for Medicaid, but there was that 1115 waiver that Oregon Health Authority put through on the Oregon Health Plan, which allowed something called continuous eligibility, meaning many children that are ages between 0 and 6, they don't have to go through a redetermination until they're older than 6. And for most adults, it's a 2-year redetermination process. Some of the caveats, though, that I think this commission, especially, you know, hopefully is aware of, is if you have long-term services and supports or some of those specific programs, you are still on a 12-month annual redetermination. That's the difference the feds had of us checking verifications and doing things. So we had that at the same time that we're implementing, and there was a basic health program, or the Oregon Health, OHP Bridge program, that's what's called. And so that program allowed individuals that were up to 200% of the federal poverty level to receive benefits. if they don't have minimal essential coverage. And that, again, is one of the nuances I always like to point out to the commissions. The Affordable Care Act that rolled out and expanded Medicaid eligibility to states, its goal was to help people provide coverage. And so there's a part in the law that says minimal essential coverage. And that means if you don't have insurance, the basic coverage of insurance. And so one of the things they count of having minimal essential coverage is Medicare. And so I regularly get to talk to individuals that unfortunately sit there and say, why don't I get to have OHP at 200% of federal poverty level or a higher level? I have SSDI, Social Security Disability Income, and I'm getting a Medicare savings program instead of Oregon Health Plan. It's because the federal law says they have Medicare. And so unless you are one of those dual eligibles, also receiving long-term service support or a parent, caretaker, relative, very nuanced program, you unfortunately, we don't get to qualify you under those programs. So I share that to say it is really complex work. And so we have been moving through that. The end of the redetermination period ends for most people, and there's a caveat here, by next month. So at the end of December, we'll redetermine everyone in the state, other than a very small, between, and the number fluctuates every day, 300 to 3,000 individuals that, as we look through their cases, we're going to reinitiate them as we were going through it. These are cases where, as children, we had reviewed the family for it, and the child has been able to maintain. They still have areas, but we need to give appropriate notices to the family saying your child has us assigned as eligible, but you may not be eligible any longer. So we're having to work through some of those things. So I share that with this commission to say a lot has been happening around medical. And as we work through this, we're having to learn a lot. There was a recent Secretary of State audit that was just completed around the One System. It was the longest audit, second longest audit I've ever been on. Some might remember something called Money Follows the Person. That's a federal grant that has good qualities in case ODHS APD decides to pursue it in the future. But at the time, it was a very long audit. I'm not looking at Jenny right now, but for those that don't know, Jenny one time almost took a job supporting those audits and work, and then she took a different job. So, but yes, as we move through it, this audit was almost 2 years long. And what the Secretary of State found as they did this audit is that their quote is largely the One System operates as expected, meaning it does correct determinations. Where we see errors is, and I say this delicately as I say it, is through input errors, usually by staff as they go through things. And they called out, and I appreciate this, the complexity of the rules and changes and how much information that they see in there. And so they had some recommendations that we're working on to better support staff as we move through this and look at how we can simplify parts of the systems. So we'll be continuing to work on those areas. So long way to say, a lot is happening with eligibility just to continue to move through it. Right now is open enrollment. So we talk about this regularly since the Affordable Care Act. Every November or so, the dates can change slightly, but around November 1st, the open enrollment happens. This is for people that are applying for right now through the federal government health insurance. So that marketplace where you can buy health insurance, it's their chance to buy and purchase this. I say that because the messaging is always complex and confusing because they send letters to every person saying, go and get your insurance or you might not be covered, including many of our Medicaid individuals. So as we continue to try to remind people, if you have Medicaid, other than if you have a redetermination due, you don't need to do anything during this time frame. But we get a lot of people referred to us during this time frame. They will go to apply for insurance, and if they look like they may be eligible for the Oregon Health Plan, they are then referred to us. So on the very first day of November 1st, we usually get a few applications throughout the year. We saw a 240% increase in the number of applications sent us the first day. So If you are looking to engage with one of our offices, I will just continue to encourage that there are multiple ways. If you call our phone lines right now, our wait times are longer. The first 5 days of the month, we average 30-minute wait times for our statewide call times. That's the average. So that means some were shorter and some were longer. But you can continue to go into your offices and AAA areas. So I always want to remind, because I regularly talk to individuals that say, oh, your call times are just so long right now. And especially individuals that are connected to long-term service and supports, I remind them saying, you can go in the same office where your case manager is and engage with any of the eligibility staff in there. You can go to any location you want to. You can apply online, more than welcome to. You can do updates online, but you can do any of those areas. The goal is choice around it. So I just always, when I get a chance, want to remind there. And then finally, and then I'll open up to any questions and things individuals have. I've been talking a lot about medical. Obviously, there's a lot of things happening. I think you all might have been talking about some of the Oregon Health Authority changes they have coming out on benefits. That's a step aside for me related to it, but I get to hear a lot around it. We have food benefits and other programs that continue to remain out there, and encourage people to apply for those as they look at any needs they have, especially during the winter timeframes. We continue to hear from individuals that on Medicaid as we look across this, and so we did a recent analysis and found about 15% of Medicaid individuals that weren't receiving SNAP were like categorically eligible, not even needing me to click extra buttons. They just simply had to agree to do it. And so we have been reaching out, and many of these are seniors that receive benefits such as meals from the AAAs or in their local areas. And there was a misconception that they couldn't receive both benefits. And so I always want to encourage saying your Older American Act programs and SNAP can work together. Some programs aren't like that, but you can continue to receive those benefits. So just appreciate those areas. And my final area that was a side talking point here. My final area I just want to provide an update to you all is we're continuing to do a work group with the AAAs and with ODHS. And this is really around our processes for specifically complex cases that we have to work. So when you apply and you are also going to need long-term services and supports, or you're also potentially needing some of these additional benefits, unfortunately, under federal law, it is a much more complex area. We look at your resources, your banks. We have to look 5 years back for things. There's that case manager assessment. And so it's different than what I would call the majority of medical applications. You know, those are a much more set income. Here's this. And the Affordable Care Act really gave some flexibilities there. And so as we looked at cases, what we've heard from many of you all for several years now was a couple issues. One, making sure it's timely and accurate. And then two, really from that customer service perspective, you end up talking to 3, 4, 19 different people. And each person that touches it means, one, you have to share your story again, and two, the potential for error. And so while I am a big proponent of saying we should provide you choice, that if you go to an office and you want to drive to a different office, that's your choice. Like, you should have that. It was never the intent to make people have to talk to multiple people. And so what we are working on is we have a change that right now, I think they approved yesterday, is set for July. So we'll start to see it in August of 2025. I know that feels long away, but my world is always long time frames. What this change is they're looking at how do we support these most complex cases and have something that I call soft case management. And what that means is when I start working an application, I will be able to have, I'm going to use the word focused workers that are trained and regularly process these type of applications. And these focus workers, once they start working your application, they work it till that person is all complete. So in theory, I don't have 19 different people potential pulling parts of your paperwork, but it gets directed to that person. Now you can still go anywhere. And the nice part of this, if that person wins the lottery and says, see you, we don't have like we did in the past of trying to dig through their files to figure out what's going on. Anyone else can pick up the cases. So we have coverage no matter what, but it will allow hopefully some better quality and really ownership of who needs to complete the cases in some of the quality areas. So we have a work group working on that right now, and look forward to seeing what hopefully some of those benefits that will be able to come from it as we go to implement that. So with that, I want to pause to see if there's additional questions, rumors, or things that I can answer specific to this commission and group.
Hi, Nathan. This is Commissioner Adams. Could you explain more about this SNAP program that was supposed to be where it's only made for homeless, the people with disabilities and seniors that they can take their food stamp card into a restaurant or a retailer, and that they're also setting up or looking for people to come on the advisory committee for that?
Yeah, so as we do this, it'll be a great chance to connect with Heather Miles, who's also just, if you haven't had a chance, Heather Miles is the director running that program. So this is called the Restaurant Meals Program. FNS, Food and Nutrition Service, federal government gives flexibilities for states to allow us to have different types of food. And so over the years, you've seen us go from you can't have hot items to allowing certain types of hot items again around it. And then as we've looked at this, and California has this up and running, I think they have one of the more expansive programs that's running well, in my opinion. And that's just my opinion. And I don't usually say California running well, so I should note that. But as we look at it, what the program allows is certain individuals to be able to use their benefit at restaurants. And part of the reason is not everyone has the same access or time to be able to cook the meals that we provide. We've seen individuals constantly on our SNAP benefits have to buy pre-made meals that have different health benefits to it, maybe not always as good, and even struggle being able to have the time or place or resources. Individuals experiencing houselessness is a good example of this, obviously, as we look across it. So the program, what they have been given is there was a bill that allowed the agency to go out and look at the feasibility and write a report of how we could implement this, and if possible, request and even do a pilot around it. Some of the complexities to it and why they look for members is one, to understand what the goals, areas around it. Some of what I'll share from the California side and their experiences, doing the benefit part is pretty easy. We can give authorities onto your EBT card to be accepted. The hard part is convincing restaurants to sign up and get enrolled to be able to do it. Because what has to happen, similar to if you go to any of the farmers markets and try to use your EBT card, they have to have a machine and be registered to receive those funds and be able to do it, and look at any limitations, because FNS, for example, won't let us have individuals purchase alcohol. So if they go in a restaurant, they need to be able to define if it was food, and if there were alcohol purchased, that would have to be someone's cash or outside of their EBT card benefit. So those are some of the things they're really looking for a work group around this, and really wanting to understand what the pilot should look like and how we support the right populations and individuals as you look at this, and what the benefit could be. Because only a few states are currently doing this, but it's an area they're continuing to look at. And I'll share one other Commissioner Adams area as you look around this. As you look at, I'll call it mail food, I don't know what to call it, but as you look at the Amazons of the world and the rest, they're starting to get into the restaurant business, the ordering areas, things coming to people. And that's another area FNS is trying to understand, how can we use EBT cards and get to the right things. The hardest part, though, seems to be, how do you sign up providers? What are the requirements and how that works? So Heather Miles is currently working on that area. We have a placeholder for one to send any file updates around it, similar to, for those of you may know, in the Tri-County area, there's some counties that are allowed a cash out program for SNAP. And so they receive the ability to have cash related to it instead of it. We only have certain counties that are approved for us federally to do that in. And so we just send details so they know who's eligible. If they decide to do a pilot in only in certain counties, that's where we will just have to make updates to say Nate can do it, but Jenny can't because of where we live. And Jenny, thank you always for letting me pick on you through these meetings.
Sure thing, anytime.
Commissioner Adams, does that help some? And again, I would encourage Heather would be a great person to come here. Plus, I admit her accent just makes me happy whenever she speaks, if you haven't talked to Heather before.
Well, if you get a chance, let her know that it's been handed down to me in my email, but the problem is it has no name on it, on who to contact for this.
I will pass that along. And if it's all right, Jenny, I'll include you just as we have follow-up, but I will, Commissioner, share that along to them and make sure that we have the right follow-up.
Thanks, Nate.
Other questions or things you are having, pain points or things, again, I always want to be open to this group to say, is this true? What's happening? You can ask me anything. We can talk notices, and that is an everyday conversation for me.
Is the one system ever going to get it straightened out that one person doesn't receive 2 letters in the mail at the same time? One saying they no longer have food stamps, and the other envelope saying, yes, your food stamps are approved.
That is a different one than an issue that I've heard. So,
that's been going for years.
All right. I'm going to take that on, Ruth, and double check around it. So we are making some changes to how notices get sent out to individuals. And some of this has been a policy move for a while. Right now, what happens is we run data things every day behind the scenes. So we get Social Security sent to us in real time all day long. And so from a policy perspective, they thought we should send you a notice every time, even if nothing changed, just to say, hey, we reran your data. So when we first turned on the system, we sent some people 109 notices every month. That one, sorry for those individuals. The two, I'm a steward, and that I was not happy with. So we've been slowly working with them. And so we just did a change this month to say, can we stop sending some of these notices that are going out? A SNAP is a good example where they will sit there saying, well, in this time frame, we should say they are not eligible, even though it was our delay and they are eligible. And I would sit there going, can we just tell them the right answer? They are eligible. And for medical, we were continuing to still send out notices to say, hi, you're still eligible this month. And so people were getting a 17-page notice every month. You should not get a 17-page notice every month. We should send you a notice if you've engaged with us and shared that, you're pregnant or had a change in condition, you're moving, whatever. We can send a notice to say, great, got your information. Here's what's happened around that. Or if we get information and it's, the lottery says, hi, Ruth won, she got $1 billion. We might send a notice to say, hey, Ruth, congrats, and we need to talk. But outside of if there is a potential change or we need more information, we're going to pull back those notices because the notices really aren't as clear. Unfortunately, some of the changes, especially for medical notices, have made them even less clear because the federal government said we should send you notices that says, here's your household and you as individuals all in the same notice. And so we send a notice that says, you are not eligible, but some of you are eligible, and here's your different information. So we're continuing to work with legal advocates in the federal government to say, there's got to be a better way we can do this. So please continue to share. What I will open up to you all is my email, I think is usually out there. Jenny, Heidi, the team can provide it. If you ever are just sitting there and you're like, oh my goodness, this is the most annoying thing ever. It's 2 a.m. and you're up bothered by it. Send me the email. You can send securely to me if you want to send a specific notice. If it's about your personal case, obviously don't include everyone else around it. But if it's about someone else's or you hear things, I may not be able to tell you their final outcome, but I do want to hear about these because it really does help. Because similar to what you just brought up, Ruth, here, I have a team that I can go and say, why is this happening? Let's pull some reports and see, because this is not my expectation of what should be happening. And I will come back, or Jillian, if she gets the steal of the spot from me, we will bring information back on that.
Nathan, this is Commissioner Adams again. There is one concern, and I addressed it to the committee that I'm chairing on, and that is the long wait on phones when people are calling in. And we've talked about it in this committee that I'm in and Ruth is in. And my concern is, if the wait is really long, then people are not going to want the service, especially the work that we're doing in this committee. Is there any way that the narrow down times can happen? Not waiting a long time.
Yeah, so that is the question of the day, the week, the month, and the year as we go to this. So a couple of things, Commissioner, and for this commission be aware of to look at it. First, I want to acknowledge where we are around time. So if you ever want to see our call times, first off, on benefits.oregon.gov, it's a website. I can put it in the chat in a minute here. There is a dashboard. You can see our call times and the long time. I always want to be transparent with individuals. And as I say this, I always want to remind you still can go into an office. Again, I always emphasize that, partly just because I've spent the first several years hearing from people, and especially, again, our individuals we're serving that received case management through an APD or AAA office, feeling like our communication was, you have to call us. And I was like, oh, please don't. Like, if you know that office, you like them, go in there. If you don't want to travel in, you can still call that local office, and you can call us too if you want to. So I always want to reemphasize that, partly because, so our caseload, we are serving over 1.5 million individuals, and those are unique individuals. And when I say unique, it means some of them are receiving multiple benefits. So back in the day, it would have felt like we're serving 2.1 million individuals if you look at people receiving multiple cases. We are staffed for 50% of what we need. Medical before the pandemic was just short of 1 million. After the unwinding, we're still going to have around 1.3 million. SNAP has gone up since the pandemic, and it is not going down. The most recent forecast has it continuing to go up. And so as we look at childcare is literally on a wait list right now because the changes the legislature made to policies, just it's too costly by too many people being eligible. And so we are struggling with those areas. During the pandemic, one nice thing we've had is it's a contractor, PH Tech. They've been answering, I'm gonna use bad words here, forgive me, the easier to answer questions. They're not allowed to process eligibility, but they could do the updates, tell you your benefit status, do things that way. That contract was only allowed during the unwinding, and so in December, they go away. They were answering calls in 30 seconds. We're going to continue to average, our goal is 15-minute wait times. But as I mentioned, this week we had over 30-minute wait times. And as I've done projections, depending on the amount of people continuing to call us, it could go up to 40 or 50-minute wait times. And to your point, Commissioner Adams, that may deter individuals. And so a couple of things we're trying to do. One, for those willing to use it, we're trying to put self-service in there. The phone system we have, it's a statewide phone system. It is not great. Sorry, I'm just going to own that. It's all agencies have to use it, and it's very costly. We actually weren't on it for a number of years because it couldn't do what we needed it to, and we were required to go onto it. And now I am fighting to get us off of it. But as we do it, I want some of those self-service, your ability to check in there and get what's my benefit status. Can I request an EBT card by pressing 2 and it will just mail it out to me so I don't have to stay on the phone and talk to individuals? So we're putting some of those automations for those that want to do that type of service. We're also continuing to work with our local offices. So as the pandemic happened, a lot of us went to work remotely. And so we've been talking to our local offices, going through stats that we have of saying, here are people that you have said, we can't serve you today, come back tomorrow or next week, only because you have staff working at home. That is not an acceptable answer. And so if you're working in an office, you're there based on business need. If people are coming in, we will be there in that office. And so that is an area we are continuing to explore and look at. If you looked at our agency requested budget, a lot of it's sort of talked about in there, but with the current financial situations, a lot of it couldn't be. And so we are continuing to engage with the governor's office and legislative partners to talk about what could be done differently in staffing levels. One of the things I proposed to them is saying, we have wonderful support staff that you may engage with at our front desk and the rest. A support staff person in the state of Oregon, if they are their sole income and have a family of 3 total, they qualify for SNAP until they're at step 7 of their pay scale. It's not a great wage. It's why they move up. I love when they move up to other positions. We did a pilot where we instead put people as eligibility workers at our front desk. We were able to double our throughput on phones and all the rest because we weren't handing someone off. And so those are some of the things I'm proposing to the legislature to say, don't give me more staff, but let me hire them at a higher classification and let them serve people more fully as they work across this. We're continuing also engage with case managers to try to help out. So Commissioner, unfortunately, I don't have the magic bullet, the solution to every part of this, but it is something we are tracking and looking at. In fact, at noon, I will be at the Public Health Emergency Executive Steering Committee that will be talking again about potential phone calls and phone times as we look at this, and things we're trying to mitigate around it as we look at it. So if there's thoughts or ever recommendations or miraculous solutions, want to talk about those, we continue to engage as well. And I can't tell who all from AAA may be on here, but talking about 211 and those solutions, and not 211, that's 211, ADRC, and just saying, is there a cross funding? Is there ways to us to do work, et cetera, where, you know, we can consolidate things, or I can help provide resources or supports in other ways. So I just appreciate any partners that continue to think about how we could solve this, but that is always a fear for us.
Thank you.
Thank you.
I'd say I know I'm at time, so Ruth, commissioners, Jenny, anything else you have for me today?
I don't hear from anyone.
All
No,
right.
I just thank you for your very thorough update.
Yeah,
I appreciate it. One day I will get better at having a written or a nice picture version for you all of updates, but I dream of those days. But again, please, I'm going to put in the chat. I will turn off my camera and mute myself, but I'll put in the chat a couple links to things and my email. Please send me if you have thoughts or concerns or as things come up. I really do appreciate your support. And since I just heard this, I want to publicly say I'm excited for Jenny Coakley to serve as your permanent executive director related to this. I have worked with Jenny for years, and she has passion around this work and the work that you all do as a commission and understanding your roles. And so I'm just excited for this. So congrats,
Thank you so
Jenny.
much. Thank you.
thank you.
All right. Thank you all.
Okay, Heidi, is our next speaker here?
Not yet.
Yep, I'm here.
Oh, Cola.
Okay.
Yeah.
Oh, there you are. I'm
Yeah.
sorry, Cola.
No worries.
I couldn't find him either.
I'm hidden at the end of your list, I guess.
Okay, then you're on.
Okay. Do you have the? Okay, I'll share here then. Give me one moment, real quick.
and we'd ask you to introduce yourself and
Sure. So I'm Cole Bickford. I'm a budget analyst with ODHS. Home Care Commission is one of my budget areas. So the previous person, Brian Holman, he's no longer with ODHS, so I'm temporarily filling in for him until a replacement's found. I have applied for the job, so hopefully I'll be seeing you guys for the foreseeable future. Let me share here. Oh, I don't usually use Zoom, usually on Teams. There we go, share. I want to share. I think I want to share this screen so you see yourselves for just a hot sec. Okay. Can you guys see the report?
Yes.
Great, so let me zoom in a little
Can
bit.
you zoom it in a little bit,
Yeah,
please?
there we go.
Yep.
Okay. Top line, our total budget for the biennium is that 11.8 million. For general fund and other fund, our budget is just about 9 million. That's that number right there. Let's see, currently by the end of the biennium, we're projected to be under budget by about 700K. That's a bit of a change from previous months, and I believe from last time we spoke. The change is primarily driven by a different fund split for a lot of our payroll. We're now able to utilize more federal funds, thus saving us state dollars. Excuse me. When we project this out through the end of the biennium, we can see there will be more savings in general fund. Since last time we spoke, also on the payroll side, there was a pay equity reevaluation done by DAS, Department of Administrative Services. This slightly increased our expenditures without giving us any additional money, but compared to the change in fund splits, this impact was relatively smaller. Here we have rolling 6 months rolling 6 months of our expenditures by budget area. We did see what we thought was a bit of a spike in August here, but that turns out to be, at least in large part, a miscode. So we should see that fixed in, I believe, November when we see November close. Here we see the same rolling 6 months, but with the main payroll index removed. So we can kind of get a better sense of our non-payroll related expenditures. Here we have our first budget area. Our total fund for the admin budget area is about 7.9 million. And our GF and other fund budget is about 9.7 million. And our GF and other fund budget is about 7.9 million. Current spending through the biennium for state money is about 57%, this right here. Well, again, we are about 63% of the way through the biennium, so we are under budget in this area, which is great to see. And given this is our largest budget area, this is where we think we'll be deriving most of the projected savings at the end of the biennium.
you have a question.
Oh, sure. Go right ahead.
Yes, thank you. This is Paul Johnson, Commissioner Johnson. So it looks like we're doing well in regards to percentage. We're a little bit below. Do you feel good about that, or do you see anything of concern so far regarding expenditures and the budget that we have?
No, so I think we're in pretty good shape, especially with that change in the fund split, getting more federal dollar match. I think that puts us in really good shape for the end of the biennium.
Thank you.
Yeah, no worries. Let's see. Yeah, so that 57%, and we're about 63% of the way through the biennium. Down here, we have the admin budget broken out by budget area. So the admin area here, this is the unit where we'll continue to see the federal fund numbers go up, the fund split for payroll. So we'll see that this number increasing more and more, and we'll be saving some state dollars here. In the training unit, we're well under budget and continue to get a good federal fund match there. For the ERC unit, we also have a significant federal funds match and we'll be under budget. For the registry, we haven't seen any spending yet in the biennium, but this is a relatively smaller budget area, just 50K budgeted for the biennium. For you guys here, we've got a little unit for you guys, 11K budgeted. You've only spent about 129. So you've got some spending to do in the next few months. And then last one here, workforce support and development. This is where we saw that miscode. So this number will change in the next few months and will look a lot more reasonable than spending 400% of our budget. This here for our admin area, we see a breakout of personnel services and services and supplies. The dark blue line, personnel services, that's our staffing essentially. You can see that's been relatively flat over the past 6 months, the past 2 quarters. And services and supplies, again, this is that miscode. That's more variable and does tend to lag a couple months behind. So we will see kind of a spike towards the end of the biennium, but no big concern there.
You have another question.
Oh, sure, go right ahead.
Hi, this is Commissioner Adams. If you go back, this right here, on the 50,000, can you explain, is this something that can be added on to next time's budget, right?
We won't be able to, there's no carryover from biennium to biennium. So it's kind of use it or lose it.
So what do you do with this 50,000?
That's a darn good question. I don't have a good answer for that. I don't know, Jenny, if you have any thoughts as to what how we could spend this.
Well, I think that we will we'll see some expenses in that area because there's been some changes to how it's hosted. I'm not getting the words right, but it's moved to Azure. And so I think we'll see some costs there. I'm not sure why it hasn't hit the budget yet.
Okay, that might be one of those things that's in arrears. So we may be seeing that hit in the next couple of months.
And so my next question would be 11,212 and $129. What can us commissioners do to, or what is this? What are we spend? What can we commissioners do to spend money out of this?
I don't know myself, Jenny. Again, if I could defer to you if you have any thoughts.
Yeah, George, I believe this is for your stipend payments. So you just need to submit them so you can be paid. And I think we're seeing, not expenses there because it counts toward income in that whole issue. But that's what that budget is for.
So that's what the 11,000 is for.
Yeah.
Okay. Thanks.
And Commissioner Johnson, I see your hand up as well.
Yeah, just maybe not a question or comment. So I'm thinking, Jenny, and I wonder if there's with some of these areas where there's maybe more available funds, like the ERC, for example, or the home care worker training. I'd just be interested at some point in time knowing if there's, if these funds, if they're extra funds or non-use funds. It'd be interesting to hear if there's any plans to use those in those areas from your staff at some point. In other words, is there some thoughts or proposals? It'd be just interesting. We want to encourage those folks in those areas. It'd be interesting for me to know if there was some ways in which they're envisioning the use of these funds in the future, since they're available to be used. Thank you.
Marcia here. It's my understanding that if we receive a stipend, a per diem from another agency, that we can't file a claim for Oregon Home Care Commission. Is that correct?
I just read that information and I can send that out to you, some frequently asked questions from the governor's office. So yes, if you're already being compensated, say from the Governor's Commission on Senior Services, you can't also be compensated through the Oregon Home Care Commission for the same meeting.
True, but if you are doing totally different meetings, what about
Yeah,
that?
I think you just can't claim both. So if you're representing a commission for one meeting and a different commission on another meeting, you could be paid through both commissions.
You can.
I'll send that information out to the commissioners today.
Thank you.
You're
Thank you.
welcome.
Alrighty, any other questions?
This is Commissioner Adams again.
Mhm.
Could we, you gonna need the commissioner's approval on the 50,000, right? Or no?
I believe that can, and Jenny, correct me if I'm wrong, but I believe that can just be spent, correct?
Yes, I think there's some flexibility in the budget. You know, if one area needs more funds than another area, that's been my understanding, is that there's
Yes,
room
yep,
for flexibility there.
definitely.
But I think we will see some expenses in this area.
And so with the budget, you get both state and federal together to get these dollar amounts, correct?
So the budget you're seeing here in this column is the total funds.
For both the federal and the state, or just the federal?
Yes, both together.
Okay. Because I was going to suggest something. As us being commissioners, could we get something like I don't know, a really nice notebook out of the funds that's not being used?
I don't know the rules around that myself. I don't know if anyone else has any insights on that.
I don't know either. Perhaps any of the commissioners, have you received like office supplies or things like that from the commission to do your work for the commission?
And not that I know of. And this is something that we can discuss in our regular meeting
Okay,
at another time, so we don't take his time.
okay.
Okay,
Go ahead.
great. Yeah, so here again, that was the payroll and service and supplies. This chart here shows the decrease in state dollars we are now spending on payroll due to the change in fund split. So we can see the general fund spending from June to July there go from about 215 a month down to around 150K a month. So it is good to see that savings in state dollars. Down to our next budget area, developmental disability and mental health. Our total budget for the biennium, so this includes state and federal dollars, is 780,000. Our general fund and other funds, so state dollars, is about 250K. And as you can see, we've only spent about 59% of our total biennium, so just a little under budget here, which is good. So we're tracking pretty well. So no major concerns for this area. And again, you can see we get a pretty good federal fund match on that. So saving some state dollars there as well. Our next two budget areas, traditional health workers and EEW, enhanced and exceptional workers, are two smaller budget areas. Traditional health workers is about 88,000 for the biennium. We've only spent about 27% of, sorry, give me one sec here, 27% of its total budget. And EEW, Enhanced and Exceptional Workers, again, another small budget area, 163,000. And we've only spent about 21% of the budget on that. Our final budget area is the training stipend. That's a little larger. That's about $1 million. Here we have the spending in each unit. Total, sorry, for the whole budget area. Again, we're a little under budget. Good to see. And then by unit here as well. There's the breakdown. Predominantly, this one area, HCW, is the bulk of that budget. Final item, training revenue has not changed since last quarter, still stuck at $700. And that is all I've got. Any other questions?
Okay, we thank you.
Yeah, I
And
appreciate you guys and all your service on the commission.
okay, and there, if we see something later on, we may want to come back and ask you something in certain areas.
I will no longer be on the meeting, but I believe, I don't know the
Well,
correct.
I'm talking about in between meetings.
Oh, sure. Yeah, absolutely.
Yeah.
Absolutely. Yep.
Okay,
Sounds great.
thank you.
Thank you all.
Okay, have we heard from Williams yet?
No.
He still has about 10 minutes.
Okay,
I can always move up the provider navigator update since it will be quick.
okay,
Okay. So I'm excited to say that we do have some contractors in place to provide provider navigator services. Very excited about this program. Just a reminder, it's for new applicants who are wanting to join the in-home workforce and currently enrolled providers. So the idea is to kind of go alongside an applicant to make sure they get through the process successfully, and they are provided extra support to do that. Somebody there to help answer questions, make sure they do their background check timely, help them register for orientation, complete their paperwork. And then once they become enrolled, helping that person register for Carina, use Carina, how to use the electronic visit verification payment system. So if they're a home care worker or a personal care attendant, if they need extra help using the PTC system, or if they're a personal support worker, how to use Express. Some skill development areas like interviewing, professionalism, using technology, different things like that. So we do have a couple of contracts in place right now. We have the ARC of Oregon, who will be providing provider navigator services for home care workers, personal support workers, and personal care attendants in Deschutes, Jefferson, and Crook counties. And then Lane Council of Governments will be providing provider navigator services for home care workers in Lane County. And then we have Rise Partnership. We just signed off on a contract with them. They will be providing provider navigator services to home care workers, personal support workers, and personal care attendants in Washington County, Multnomah, and Clackamas counties. So we are doing some orientation onboarding with Lane County and Rise Partnership, and as soon as that's done, they'll be open for referrals. We also sent out some information to currently enrolled providers in Lane, Deschutes, Crook, and Jefferson counties, letting them know that they are able to make self-referrals for that program. And they started making referrals, so that's great news. And as soon as Rise Partnership is available to take referrals, we'll do the same thing, sending out that message to the providers in those areas and also sharing the information with the local offices so they can start making referrals. We had our last opening for requests for applications for the program, and we received 3 more people interested in providing Provider Navigator services. I can't tell you anything about them yet because we're still in the scoring process, but I'm very excited about the program, and I'm glad that we finally have some contractors in place. Any questions?
Yes, you have one from Paul.
Hi, Jenny. Can you tell us more about like the orientation for
Yeah.
these? I'm just concerned, like, for example, is it just over all the at-home programs or more about, so, I mean, you've already described it to a certain degree, but what's involved in the orientation? Is it a one-time orientation or is there some type of monitoring or follow-up?
Yeah, thanks for asking. That's a great question. So the orientation we've had already, it's kind of an overview of the enrollment process for all 3 programs. It's learning about the background check process. So we've had somebody from the background check unit come and talk about that process. Somebody to talk about Karina and required training, how to use the learning management system for Carewell. Roberta's talked about our training programs. They're getting information about the electronic visit verification system, and I'm sure some other areas. It's to provide just like additional information, specialized information for them on what they may need to know or what kind of things they might come up as they're providing Provider Navigator services. It's a one-time orientation, but we've also made resources available to them, contacts that they can reach out to if they have questions or certain issues coming up and they need to help a provider with. We've given them special, access to individuals that can help answer those questions and walk them through the process. So this is a program that's available through March 31st of 2025. It's funded through the ARPA fund. So my hope is that, we can prove that this is a really valuable, successful program and try to get ongoing funding for it.
Randy has a question.
Yes, so Jenny, if you're not in one of those areas that has a contractor, are we going to be able to utilize the services cross county?
The contractor has to be willing to provide services in those counties. So if this goes well, thank you for asking that question. Some of the counties contractors have started small so that they can kick it off, and then depending on how it goes, they'll expand their reach into other counties as well.
I have a follow-up question if you don't mind.
Yeah.
This program and the other additional ERC sort of, I'm having
The
a hard
linking, yeah, linking.
You know the other one that I'm talking about.
Yeah.
It also has sort of an expected end date at this point in time for March, which I hate to say is right around the corner. So, for example, my agency added an additional staff to the ERC program for the other program and have this moment where March will be here. How do you know when you will know whether these funding streams will continue? Or I know the ARPA funds aren't.
Yeah.
continue,
So
how
I
do you
know that the linking program will continue to be available. We just rolled it up under the Employer Resource Connection program and incorporated that into the budget. In terms of Provider Navigator, that's an excellent question, and I'm trying to set up some time to talk with those who can approve the funds for that program. I want us to start working on that now because yes, March is right around the corner. I really want this program to be successful and be available ongoing.
Jenny, you said that this Provider Navigator program is only going through March of next year? March 2025? Okay, thank you.
Paul has a question.
Yeah, and it might be an ignorant question, but it probably is. So would it be possible as kind of a plan B, maybe to have a short video of that showing the information from the background check unit from Roberta or others so that if the program goes away through ARPA funding, maybe we would have at least some type of way to continue it on kind of automatically. In other words, not involving individuals or funds if a video or something was available.
Thank you for asking that, Paul. I forgot to mention that we have recorded the orientation for the providers so that that can continue to be a resource. And I think that's a great idea, especially the information from the background check unit, I think would also be of interest to providers on an ongoing basis and even the local office staff, because they may not understand the nuances of the background check. So we can make that available. We just have to, I think we have to put it on our YouTube site, and we're working on that. But thank you for asking. That was a great question. Was there another part of that question that I missed something?
No, you did great. Thank you.
Okay. Everybody was so quiet, I couldn't remember.
Well, it looks like our other speaker is not going to show up. So,
She's here. She's here.
oh, she is.
Yes, she just arrived.
Okay. I still don't see her. There she is. Okay, we're ready for you.
Wonderful. Thank you so much for having me today. I pop in every once in a while, but for those of you who don't know me, I'll go ahead and introduce myself. I am the communications manager for the agency, and my primary role is handling communications for our 6 large programs, including APD. And some of you may have first gotten to know me when I was communications officer for APD. So really happy to be here with all of you. I know that Jenny and David have likely been giving you periodic updates on the investment that we are making to recruit home care workers, personal support workers, and personal care attendants. And I don't know if you were aware, we had finished the contract, and we now have a contractor on board. It's Metropolitan Group, and they're working on a scope of work that will be within the timing required under the funding that this program has received, which is the American Rescue Plan Act. And that act requires that we have work done by March 2025. And we have found a way to make that happen, but also provide that we will continue this recruitment process through the end of March 2026. And I can talk a little bit about how we did that. Any questions about the contract itself and the contractor that we've selected? And I have to look at the chat here. So I don't see any questions. So the work that we are doing right now, and we are doing it at a very fast pace, is the research work. So we have provided the marketing communications contractor with all kinds of information about the Home Care Commission, about these rules, about the 3 programs that are served through these roles: APD, ODDS, and OHA's behavioral health. We've also provided them with broad data on the current home care workers and PSWs and PCAs that we have, what some of the issues are in terms of attracting and recruiting people, the the problems we can have of having maybe plenty of people, but they're not the right people. So getting the right people with the right skills to match the demand. We have shared with them the diversity of workforce that we need to be able to serve people, as well as the desire to have people with various certifications. So we've given them basically pretty broad background, and they're still absorbing it and working to understand it. They have asked us for information about partners that could also be helpful, and then getting educated on this workforce and what the needs are. And so, you know, in addition, we've explained to them how the commission works, but I wanted to let you know that we will be requesting a time for you to meet with them and educate them and provide them with some information and guidance as they move forward on this research project. And we are working to get those requests set up, but I just wanted to make sure you knew that, and you knew that that was coming. Do you have any questions about that?
Doesn't appear to be any questions.
Okay, thank you. So the to get to kind of the talk about the work that's going to move forward, once they finish their kind of their secondary research, they will move into deciding the type of research they need to do to add to the information that we already have. And this research, oh, Paul, I see you have a question.
Yeah, I didn't mean to jump at you there in mid-sentence, but does the research also involve, and you don't have to answer this right now, but maybe while you're here, kind of like maybe surveying or talking with existing home care workers or those who have left the workforce to discover some clues or ways that we can encourage those who want to leave to stay, but also encourage those that are there to be advocates and allies with us to promote among their friends and others the work of a home care worker.
Yes, they do plan to do that, but would love, and this is why the interaction with you will be so important. They would love to get your guidance on that. The project scope includes doing focus groups and a survey. So I think getting your input on that will be valuable. We know that you raised a really important point. We want to recruit people. We also want to keep the people we have. That information will be really important. I'm glad you raised that. And how we shape those focus groups and those surveys will be based on getting input from you and learning more about the current challenges and the current strengths of the program. Jenny and David, do you have anything you want to add to what I've already said?
I don't.
Okay.
Yeah, I would just add, like, we had a great conversation with them. Was that yesterday already? Oh my goodness, it feels like longer ago. But just about helping make the website, our workforce website, a little more smooth for people and easier to navigate. I feel like they're being really attentive to learn and to really understand the uniqueness of this workforce and what is needed to draw people into it. So yeah, that's all I would say.
The websites and how we organize the website to be easy for people to use will be a big part of their work. I'm so glad you brought that up, David, and that kind of tees up some additional information I was going to share. So they are going to be looking at all of the websites we have that represent the Home Care Commission, home care workers, personal support workers, and personal care attendants. And then they're also going to be looking at competing websites. So for example, in the ODDS world, looking at sites that are available for direct service professionals that work for agencies on the DD side, just because we want to make sure we have a really good understanding of what the competition is as we're trying to recruit people. And then also what some of the potential points of confusion could be. There's a lot of different websites that mention this, and we know that it's hard for people that even kind of know our system to navigate through, and we really want to make that a lot simpler for people. We also want them to do research that helps us with, if somebody's looking for this type of job, what are the kinds of questions that they would be asking when they search on the website? And make sure that we do advertising so that when people search those terms, that our websites come up. So we get a more prominent profile as people are looking for jobs. Paul?
Yeah, thank you again. This may be a plan, but it seems to me as well, apart from just kind of the overall perspective you're describing, I just always think of some different immigrant communities or refugee communities. You know, they may, in other words, I guess I could say it this way, at least my opinion, is that, getting their attention, recruiting and promoting opportunities may look a whole lot different in those communities than it does in the overall general population. And in a strategy that, and I don't really know the details of what I'm saying, I'm just kind of making a statement, a strategy that might focus on some of the larger immigrant or refugee groups, a unique strategy that's targeted just in those groups may be beneficial, and many may be looking for work or interested in work that's available to them, especially if it's in languages and among people with whom they feel most comfortable. So it's just a possibility, if it hadn't been anticipated, to target some of those groups as well.
That is a very important point, and that is one of the areas where we're going to be needing some input. We are also going to be doing, starting out with selecting some pilot areas to test different things, rural communities, urban areas that may have a diversity in particular pockets of populations that that we should be addressing. And we will also be in the process of selecting those to make sure that we've got a good representation of the challenges throughout the state. As you know, we did some very minor advertising just to kind of test some messaging out and to see how that did. And we, in that advertising, we used a couple of different messaging strategies and tested how those did. Those we had kind of two key messages. One that was sort of geared at somebody in a job where they don't have the stability they need. So that could be like a gigs economy worker, someone doing like DoorDash, or also people that are in transition, like maybe they're taking classes at a community college. So we know that they're looking for a change. And we tested several different personas along those lines and what messaging worked. And the working with people was the messaging that worked the best. So the opportunity to work one-on-one with people and to work with them closely and support them was the number one, that resonated the most with people. And George, I see you have your hand up.
Yeah. This marketing campaign that you're talking about, is this trying to draw in more caregivers, or is this trying to draw in both caregivers and state employees?
It is just focused on home care workers, personal care attendants, and personal support workers. And then there is also a component of it that will include adult foster home operators. And that's it. It does not include state employees.
Okay, I'd like to make a suggestion if I may. With this strategy that's going on, or marketing that may be going on, I'm hoping that some of it can be done here in Sutton, Oregon, where people are also looking for jobs. I'm hearing that some people are saying that the state is not concentrating on Southern Oregon like they should when it comes to looking for a job. So I just wanted to make sure that because I'm down here in Medford. So I just wanted to, let you know about that. When it comes.
Yeah, so we are going to do statewide advertising. It will only be in Oregon, with the exception of there's some big recruiting websites like Indeed, job hunting sites. We haven't gotten to this level of detail yet, but we may be including advertising on places like that that have people that are looking for jobs. But the advertising that we would be doing, like through media companies, would only be in Oregon. The plan with the pilot sites, we'll be getting input on those. And I think the current proposal includes one in Southern Oregon. I'd have to double check on that. Nothing has been finalized. So the initial proposals was Southern Oregon. The other thing that I want to add is that as we're doing this preliminary work and the research to get information, we want them to help us identify the kinds of jobs that maybe are going away. So people would be needing a new opportunity, and also the kinds of jobs where people might be likely to leave them to go do something else that they would find more meaningful. So just as an example, retail workers, they might not be getting the hours they need. They might be looking for something more meaningful. So we're going to be doing research to determine what are the categories that we might have the best luck in bringing people over to this work. We'd like to avoid taking people from one part of the long-term services and supports and moving them into another, because that means somebody that we're serving is losing while another gains. So we're looking to try to avoid that, but otherwise looking to have a pretty broad draw on bringing people in, including people that speak particular languages and might have a particular interest. I wanted you to know that in addition, the research will include the experience of applying to become a home care worker, personal support worker, and personal care attendant, because we want to make sure that we're not frustrating anybody, that if somebody's interested, that we make it as easy as possible for them to get on board. So we'll be doing some of that work too.
The one thing that I hear the most also is a caregiver doesn't get enough hours, whether they're PSWs or HCWs, and that's why
that's a significant issue, and I think we should be looking at that in our research. Is that because they are not able to find another person to work with, or is it very difficult to have multiple people? We'd like to know more about that so we can address that.
Yeah, please do, because it's making it harder for employers to be trying to find people.
One of the things that we'll be doing as well is looking at how we could highlight the navigator and linking programs as a benefit of doing this work, that you could get that help. And I know those programs are also part of the ARPA funding. But we are going to look to see if that helps too in the short run.
You also have a message in the chat of somebody who wants to be included. It's Carwell would love to be a part of these conversations as we are looking into and working on these things too.
Well, we would love to have you included, and we do have you on our list of people to include. So I'm so glad that you brought that up, and we look forward to partnering with you and talking to you. I'll be working through Jenny and David and getting some of those connections set up.
Well, thank you, and for keeping us abreast of this, because this is our mainstay and are important to us. And we hope that anytime there are any changes, that you will come back and share with us.
Yeah, absolutely. We'll keep you posted as things move forward. And then in addition, you'll be hearing from us as it relates to getting your input on the research portion of the work that's going on right now.
Thank you.
Thanks so much for letting me have some time on the agenda today. I appreciate it.
Okay.
Thank you, Elisa.
Okay, it's time for your break.
Okay. Great.
And we're 10 minutes early, so we need you back here by 12, was it? It was a half an
12:05?
hour. 12:05?
Yeah.
Okay.
And the recording will stay on during the break, so just be aware of that.
Okay.
Hey, Bruce,
Yes,
I'm glad that our other board commission is going great
and
on the new, the one system.
uh-huh,
I'm glad it's going great.
yeah. But
I'm really proud to have you on that.
well, I can't figure out why so many people are dropping off though, that haven't been showing up to the meetings.
I'm pretty sure it can get figured out. I see Judith coming on, but she's got two Judiths down here.
Yeah, she's one on the phone and then she's also on the computer.
Oh, well, the audio is not coming. It's still waiting to come on.
All right, you quit mumbling about me. Okay. I'm having a horrible time with my computer. So I tried putting it on my phone. Because I attended a meeting and it required this new Zoom program that is called Workplace. And
Yes,
it has totally messed up my computer. And so I couldn't attend the one meeting, and today I couldn't get on until like 15 minutes ago. I've been on the computer since 8 o'clock trying to get it fixed. I don't know.
Well, did you download the Workplace?
I didn't. Oh, yes, I did.
Mm-hmm.
Yeah, because it said I had to download it to attend the one meeting, and so I downloaded it, and then I got blocked out of everything. And today, I mean, I've been trying to figure out how to get in. I've gone, switched to Chrome. I've done everything. I finally, I couldn't get on the phone. I tried for a long time, but I couldn't get anything. But obviously I did because you guys got me. But yeah, it's just, Ruth, these computer problems are headaches.
Well, I sent you a note in the chat. Can you get it?
I don't think so. Oh, here. Here we go.
I wonder if she has Windows 11.
Yes, I do.
Oh, well, that's half of it then.
Hi, Judy. It's Marcia.
Yeah.
Yeah, George and you and I can form a commission.
I can't open your chat.
The Windows 11 commission.
Yeah. Okay, fine. I'm just gonna go hide in the corner.
Well, I wouldn't put 11 in, and I keep getting messages from Microsoft, but I'm not going to put 11 in.
I think I'm gonna wait till
They're blocking me.
You what?
I'm gonna wait until I get my new computer for Microsoft to figure this out.
Where are you gonna get your new computer from, George?
Where am I gonna get it?
Mm-hmm.
Amazon.com.
Oh, yeah. Mm-hmm. Okay. Well, you'll let us know how that goes, because I think by the time Christmas comes, I will be ready to shoot this computer and buy another one.
Well, I'm gonna buy the Dell.
That's what I always have, is a Dell. This is not, but yeah. Chuck always bought Dells.
They now also have a problem where you can't attach a program now to your printer from Windows 11.
Maybe that's the reason why I can't print anything. Thank you, George.
Sorry about the bad news.
Yeah, thank you very much. I really appreciate it.
George, are you going to be a counselor on the Windows 11 commission?
Yes, Windows 11 bad news counselor.
Oh.
Yeah.
They're gonna
Smile.
to buy mine.
Okay. Are we all back? And ready to go?
Don't push it, Ruth. I'm back. I don't know about ready to go.
Okay. Then we're down to strategic planning. David?
Right. Hey, everyone. Sorry, I'm getting over a cold from earlier this week and it's been in my throat. So I may randomly just mute so I can cough. But hello. I don't know how to talk today, apparently. Hi, this is my face. I'm gonna share my screen, Heidi, and take over. Because I can.
Okie dokie, there you go.
Forgot the artichoke.
Okie dokie artichoke.
There you go. Thank you.
You're welcome.
All right, everyone. So, based on your request from last time, hi, I am David Scott Vining, the David Scott Vining with the Oregon Home Care Commission, your friendly neighborhood program analyst. And I put together this little Gantt chart for us so that we can look at what the plan is for the strategic plan going forward for the next year, since we're gearing up and it's coming up really quick. This is what it looks like. I'm going to send this to Heidi so she can send it out to all of you. This is just a mock-up, right? This is the first Gantt chart I'm showing you all, and I want to make sure that we're capturing everything that you want, so we'll have a conversation about that. But down at the bottom, you can see the develop tailored communication materials activity. This is where, and this is really going in next month, is going to be a pretty hard push for that. But this is where we're looking at making those materials for the legislature so that you all can have those ready to hand out to the legislature so that they know more about the commission. We're looking at a one pager based upon my conversations with some of, I'm sorry if I'm talking too fast. I always see the ASL person and feel bad. I'll slow down. So this is a one pager as I've talked with the communications officers. Their recommendation has been to keep it short, sweet, a really good summary of everything. So based on that recommendation is why we are going with a one pager. And I may be asking you what highlights you'd like to have in there. We'll go off of some of the information that we've already got. It'll be based off of the PowerPoint slide show that Jenny put together a while ago to inform everybody about the commission. We all love that so much, and she did a really great job. I'm just trying to make her blush right now. So yeah. That's where the information will come from, and I'll be bringing that to you for review as it gets closer, and probably not just in the commission meetings here, but it'll be outside of the commission meetings as we want to move quickly on this and not just present it during this time where we have to wait a month, right? So
Paul has a question for you.
I was just going to pause. Thanks.
Okay.
Hey, David. It seems that at some point in time there was somebody mentioned or we discussed about like giving a thumb drive as well with maybe with a letter or something that would maybe have some videos or I don't know all that would be on it, but that would provide maybe more information and some visuals and etc. so that the letter could be easily read, but then the thumb drive was there for reference. I don't know. Is that also contemplated at this point?
Yes, thanks for bringing that up, Paul. And that's one of the reasons you see in the Gantt chart that activity runs all the way through May as we're continuing to build and develop better and better parts of it. So on that thumb drive will include the PowerPoint slide itself, our videos, our recruitment videos, all of our commission videos that we've had on YouTube and on the workforce development site for a while. To continue to build up information, and we'll put that together. We're hoping to have that more finalized right through January and February, but as the legislative session starts and whatnot for everybody. Paul?
Yeah, I'm sorry, but this type of area is of great interest to me, and so my mind gets to going. So I'll try to restrain myself a bit. But I wonder too, just if we had some type of tracker, so that we know, hey, Ruth was talking talking to Senator so-and-so and, on this date and is following up, or, this is happening, just so we have a tracker where we're seeing, okay, who are we talking to and what are we doing? What are we giving them as far as information, or what interaction do they want? Just so we kind of understand kind of how we're approaching, because we would want to talk to maybe some people more than others, or I don't know exactly, but just a tracker of some type that would just help us to record our interactions or conversations, to know what's been said and what's been done or what's pending, that type of thing.
That is a great idea, Paul, and a wonderful suggestion. Jenny will start working on it right away. I'll put it together for us. I love that idea. I think that's great.
Jenny's the official executive director now, so I think we could really load her up with a lot of work, because she needs to earn her keep now that she's the executive director.
Exactly. And I'm going to delegate to David,
Wait,
David
what?
Skite Vining.
David, one of the things that we've offered is that Northwest does what we call a profile book that we take bodily to the legislators. We have offered to put your one-page flyer in it.
Oh,
That
great.
profile book.
Oh,
Look at that. We've
And
got our
so
first
that
item on the tracker.
that will go to all 90 legislators.
Love that. That's great. Thank you so much for that connection.
When's the
Ruth.
due date to provide that
Yeah.
information?
You'll have to work with Kim, but mostly it's just going to be an insert. So if you just have your flyers ready, then we can just insert it as we go from door to office to office.
Awesome. I will reach out to you, Ruth, to connect with Kim, and then we can get that kind of planned out on timeline,
Okay.
because Ruth loves talking to me. Okay, George.
Yes, if I'm understanding this right, each commissioner will be receiving a thumb drive of everything, correct?
So you'll see the thumb drive, and if you'd like a copy, you absolutely can. But the thumb drives will be mainly for the legislature to get our information out there and provide blah 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 to inform people about what we do.
So basically, we're going to be receiving it in the mail, correct?
Yeah.
And how do we apply for that?
Well, we can just get it to you, George.
Okay. Will this detailed strategy plan be in it?
One more time, sorry.
Will this strategy plan be in it?
Yep, it can.
may I request one also? Marcia?
Yeah, as soon as we get the thumb drives together, I can get one to all the commissioners.
Okay,
We have thumb drives plenty in the office, Heidi.
That, and also to send it as an attachment so that we can send it on if we want to.
Yep.
I hate to be bringing up, dear, I'm wondering if legislators will be able to accept a thumb drive at such a time as this.
We do it to them all the time at Northwest.
Oh, okay.
In fact, they would rather have a thumb drive than to have paper.
Okay, no, I'm thinking of a more sinister plot.
Yeah, no, they've got pretty good scanning equipment and keep track of anything and malware.
Okay, all right.
Yeah, sorry, Heidi. No malware on the thumb drives, please.
Yeah. David,
Other
you
events,
really know
though?
how to ruin my day, you know?
I know, I'm so sorry.
No, you're
I know
not.
you're crying. That's why you're off camera.
Uh,
Other activities that will be starting right at the beginning of 2025 that are kind of going on right now, tentatively. Gosh, I'm so sorry for my throat. But Kelly and I have been starting to interview staff members with OHCC to see where we believe our strengths are and where there are opportunities for improvements in the programs to help us be more efficient in serving consumers and consumer employers and providers as well. So those interviews are beginning. We are already beginning to work on our social media presence. I don't know if any of you have seen our Facebook recently, but Miguel has been helping me quite a bit there. He is posting on it regularly. We're trying to build up in the logarithm for Facebook so that we show up more readily when something of ours posts. And so people who might be interested in us will then see our feed and hopefully start to follow us as well. So that information's there. We're going to be making it look a little prettier as well. We have a hand washing photo on there that's been there since COVID started. So we're going to be upgrading that and getting that work done. Yeah, so it's just getting a lot more attention now, which I'm very excited about. And as we have built up that logarithm, we'll be making our own more tailored communications that we'll be sending out there to help inform people about us. Roberta may be able to speak to this one, but starting up regular community events, the Power Hour is going to be happening really soon. It's going to be mainly through the training unit to give us to start connecting with providers, just ways again, right, for us to continue to build that connection with the people that we're working with and trying to help and be there for. We know that connections are super important, and so we want to be a part of making people feel, I'm not going to make someone, but facilitating us being real people, and that people feel the connection and that we are there to support them, and they know that. The Power Hours are going to continue to evolve throughout the rest of the next year. We'll start with some training stuff, but then we'll start just doing some meet and greet things, maybe walk people through PTC a little bit more, right? Like things like that. And anytime any of you commissioners have an idea for our Power Hours, please bring them to us so that we can incorporate them and start planning for them. Any questions? Anything else you'd like to see on the charge and strategic plan? I'm going to be building this tracker for different parts of it, but yeah, that was, thanks Paul for that.
Well,
Yeah.
somewhere we need to have better communications with the AAA directors.
Yeah.
Because when I was at that symposium and presented what the Home Care Commission was doing, they were totally dumbfounded and they had no concept of what was going on. And they made comments, and I said, well, don't you know this is what the Home Care Commission is doing? And the lack of communication with the people that we have the most contact seems to be really very predominant. And so we need to find some way to work with our partners.
Thanks, Ruth. I'll definitely be reaching out to them and beginning to communicate with them.
I can't hear you. We can't hear you.
Sorry. My voice trailed off. Or did I pause? Am I good?
It's not your voice, it's the microphone. It's not very loud.
Oh, sorry.
Now it is. Now it is.
Me talking louder. So yes, definitely building up. Next year is a big year for us to build up and continue to reinforce and strengthen our connections with community partners out there, including the AAA directors.
And Paul has a
Miguel's gonna be
question for
helping
you.
me with that too.
Yeah, David, I was kind of thinking along the same lines as Ruth a little bit. I mean, I was thinking, I mean, everybody's busy and has their own areas of work. But AAAs, I was thinking of Nikisha, who we haven't seen for several months in our meetings, for example, or some of the other APD leaders. That's just my orientation. Maybe the ODDS folks as well. Okay, just the idea that I had in my mind would be, and this kind of maybe aligns a little bit with what Ruth just said, is what if we did a monthly, news from the commission or whatever. And it was just a brief paragraph email sent directly to all the AAA directors and key leadership at APD or ODDS, et cetera, saying, here's what's going on in the commission, or whatever. A very, basically highlighting things that we're working on or some concerns we have or questions we're dealing with or whatever. So that basically every month, and there's, I'm thinking every month, maybe every quarter, whatever, we're directly communicating with leadership within the department, within AAA, et cetera, and just informing them. Now, they may look at it, read it, and delete it quickly or whatever, but it's keeping us in their mind a little bit and keeping us hopefully involved at that level, at least, of communication. And so that, kind of like we do, with all the providers when we send out the Elevate newsletter. Now, I'm not just suggesting that level of communication, but something that's regularly there, highlighting what's going on, promoting our work, and also soliciting, maybe input if needed in a particular question we may have. Something like that would be easy to set up with a group email that would be sent out monthly or quarterly, whatever.
Yeah.
Thanks for that, Paul. Absolutely agree. And it will definitely be.
Can't hear you.
Thank you, Paul. I appreciate that, and that will definitely be included in our communication plans as we move forward with building this stuff. I think that newsletter was called OHCC Connections. Is that right, Jenny? Am I right there?
Yeah.
Okay, thank you.
And Randy has a comment in the chat.
She's got 2 in there now.
2 in there.
Okay.
I will answer. Yeah, absolutely. To me, CMEs are the same, right? Like we want to connect with all of them and get the information out there with all of them. Yeah, I don't even make a distinction in my head for the most part, Randy.
CMEs is the term we use, case management entities, that encompasses all the different local office structures across programs.
Sorry, I do speak in TLAs sometimes.